dear friends who have joined all ecography. Today, here we are again with one very specific and very special session of the experts in conversation with Dr. Ritu. Today, we are having a very dear friend of mine, Dr. Salwa Bahkali, all the way from the Saudi Arabia with us. Dr. Salwa, very, very warm welcome to you. Hello. Dr. Salwa is having a very, very busy schedule. As she promised me, though she was traveling yesterday, she promised to share her immense knowledge with all of us. So today she is with us. Everybody knows Dr. Salwa is a stalwart in the field of cosmetic gynecology. So here is a brief introduction of my dear friend. Dr. Salwa is MD RCOG, AAM, EFCSM. She is gynecologist, sexologist, and cosmetologist from Saudi Arabia. She is the first gynecologist who started working in the field of the cosmetic gynecology in Saudi Arabia since 2014. I can say me also, a lot of other doctors see Dr. Salwa as a role model for all of us. You have done such a marvelous in this field. She is a director and trainer of aesthetic gynecology courses and workshops in USA. She has done so many research work also. She is a medical researcher, published in 24 scientific papers and 2 book chapters. She is a co-chairman for this Middle East Association of Aesthetic Medicine. Besides that, she is a director and trainer for so many other courses related to aesthetic gynecology. A very, very warm welcome, dear friend Dr. Salwa. Dr. Salwa today is going to discuss with us what is the mystery of triangle in the aesthetic and urogenital case management. So friends, this program is going live on Facebook and YouTube. All of you having any queries, please put in the chat box. So after her talk will be finished, I will take these questions. So,
thank you.
Yeah.
Thank you very much, Dr. Ritu. I really miss you and miss all. And thank you for inviting me in this few live. Inshallah, we will talk about the mystery of triangle aesthetic and urogenital case management. As we know that nowadays the cosmetic gynecology services become one of the fastest growing subspecialty in medicine. It become one of the interested field and customer demand in our community. And why is that? Why that demand increase? The desire of the female to be beautiful and to satisfy herself or her husband by improving the genital appearance and performance increase the demand for cosmetic and urogenital service and procedure. So it was noticed that a lot of females seeking for vaginal rejuvenations and augmentation, regardless to her age, culture, even in the marital status. So why this attitude become so common? If this is the fact, this is the second question. So why ladies seeking cosmetic gynecology service? Why this attitude become so common? I think if we just think about it, the causes will find many reasons. Those ladies might have physical or psychological or sexual problem, or may have more than one problem and they want to solve it. Not only that, but ladies may have. She don't have a problem, but she wants just to improve her genital image and appearance. She might look for the perfect vagina, and unfortunately, there is no perfect vagina. Or she may want to enhance her sexual function and improve the quality of her sexual life. But this demand, what it will reflect? What do you think? This demand often reflect the insecurity of the some women, regardless to their genitalia and the fantasies. It may reflect the desire of the female to or desire of her male partner to improve the area. It may reflect the lack of low self-esteem for genital or self-confidence due to the negative self-genital image for that lady. And as we know that self-image is so important for women, and this fact is not only for the body image. It was reported that appearance of the woman genitalia affect her self-esteem and her self-confidence and sexuality the quality of her sexual life. And the good news is that women now have been empowered with availability of cosmetic option to change or repair the external appearance and functions of their genitalia. If she's want to do that, want to satisfy her thirst, satisfy her husband with the appearance, or for any other reason. But there is misperception about the cosmetic gynecology service. A lot of people think that cosmetic gynecology service is limited to the aesthetic procedure. Is that true? Do you think that? Another group of people believe that it is only done to improve the shape and appearance. And as a gynecologist, we believe that it is one of the important and one of the unique service. Why we believe that? Do you think that we believe that because we are gynecologists? No, but the cosmetic gynecology service is not any service. It's done for aesthetic or cosmetic reason to improve the shape of the genitalia or to enhance the female genital function or any procedure which aim to boost the sexual function. So, why, as we said, why we believe that it's unique? Because we are dealing with woman femininity. We want to restore her genital function and shape. And uh, if we just compare our goals as a cosmetic gynecologist and the goal of other specialty, we realize that we aim for functional rejuvenation and regeneration in the female genital system, in addition to improve the shape and contour, while most of the aesthetic specialty aim to improve the shape and contour only. Okay, so before we start, we have to differentiate between two important terms: rejuvenation and regeneration. These two terms are not the same, but a lot of people still didn't know the difference between two of them. Can you guess what is the difference? uh, Rejuvenation mean that the area become youthful again, while rejuvenation means that there was damage. We try to replace that damage and we want to repair it. Okay. So as we said, rejuvenation means restore youthful and regeneration means repair tissue. In cosmetic gynecology, we are not aiming for rejuvenation only, but we are aiming for functional rejuvenation. We want to enhance positive genital image. We at the same time we want to restore the urogenital function. When woman is unhappy or bad or had a low self-esteem about the shape or functions of her intimate area, we can do a lot for her. Uh, in our daily practice, the most common four complaints regarding the urogenital and sexual function are vaginal laxity, stressful incontinence, decrease or less sensation during sex, and sexual pain or discomfort. So, patient with these problem often express her sexual unsatisfaction and complain of performance with the sentences, I don't feel satisfied during sex as before, or she said, I feel less friction because my vagina is relaxed, or she may say, my daily activity become less because of my stress during incontinence, or she can say I have pain during sex and all and other expressions. But this is the most common expression that we have. So, and the five most common issues, the five most common issues in the vulvovaginal appearance relate to shape and size and color is the color, contour, and asymmetry. Okay, so the patients also, when she usually came and said, I hate my genital shape and color, or she may say, I become so anxious because during sex, because of my labial side and its symmetry, or she may come because she's looking for something, she or her friend, for solution for the sagging and wrinkle in the majora. But whatever the cause, whatever the complaint, I believe that any lady seeking for cosmetic gynecology procedure, she had a hidden agenda related to her sexual life. Either she want to resolve a problem, for her sexual relationship, or she want to improve or maintain also her sexual relationship, unless if she's old or had prolapse or she had urine incontinence, and especially if she's not sexually active. This that time, no, there is no hidden agenda. So, how can we help those people? And how can we do that? By offering, of course, one of the available cosmetic procedure to treat the condition and restore patients' unigenital function. Okay, so we have a lot of opportunity for offering pioneering cosmetic gynecology service. We have non-invasive, mini-invasive, and non-invasive procedure. Okay, and also we have many options to play with to have a good outcome. We have opportunity to combine more than one option together from the same category, or for synergistic effect. For example, we can use two or more than one procedures from the non-invasive options, for example laser and BRB, or we can combine different category, for example fat augmentation, BRB, or fat and lipoplasty, and whatever you want. And we can make this combination therapy at the same time, same setting, or in different setting. But before we decide which option to start with or to treat any case, we have to evaluate two important issues. We have to evaluate the quality and the quantity of the treated area. So why? Why we do that? Why we should evaluate the quality of the treated area? Because as we know, as we age, the quality of the skin and vaginal tissue are deteriorated. We know that as we age, the collagen and elastin fibers in the skin and the vaginal tissue become hardened and fragmented. So the network start to break down. So the tissue start to lose its support and its elasticity, and show a visible sign of aging. Not only that, but also the blood circulations. The blood circulations which go to tissue, it will be declined. So the nutrient and oxygen may not reach the area, which lead to unhealthy or sicky skin vagina. Also, the fatty layer beneath the skin become thinner, so the area become looser, and this may lead to end up with sagging. So if we just if we just concentrate if we just concentrate on doing invasive surgery only, which without considering the qualitative conditions of the treated area, what will happen? Of course, there will be the condition may relapse again. Okay, so have you ever asked yourself why, after doing successful anterior vaginal repair or colporaphy or whatever you want to do, the patients might come after a couple of years and complain of the same problem, even if they didn't get any risk factor, if they have no pregnancy of whatever caused this problem. Why? Because when we did only surgery, we will decrease the caliber of the vagina, which means the quantity only. But we will not change the quality of the vaginal tissue. For example, if the patient have atrophy or poor elasticity and support, we don't do anything with that. If we just, because the surgery, it's usually cut and paste. Okay, so and um, what I really noticed in my daily practice as in cosmetic gynecology clinic, that a lot of patients came and said, "Doctor, I did vaginal wall, for example, repair because of my social incontinence and because of laxity of the vagina. I feel good in a couple of years, but the same problem start again. Why? This is usually happen if we ignore the quality, if we ignore the quality and vaginal tissue and the pelvic organ support. Okay, so that's why we need to modify our practice, and the way of our thinking. We have to change it. And if we cannot do great things, at least we have to do our job in a great way. And I'm sure that all of us and all of you, we are all great and can do a lot of things. So we should think always about longevity when we treat any area. We want to restore the function and have an optimized result, and we want to be sure that the case is going to not going to relapse again, and also we want the patient to be very satisfied. To do that, I think about the effectiveness triangle. And I think if we try to apply this in most of our cases, it will give an amazing result, and this result is long lasting result, and that's what we want. Okay, so we have, as we see here, the triangle have three sides. So the three sides is quality, quantity, and pelvic support. So we have to address all these sides and take care of it. For quantity, we will do invasive procedure, okay? But we can also do non-invasive or mini invasive procedure if the case is in mild cases. We can do that, okay? For quality side, we can use the mini invasive and non-invasive procedure. And for the pelvic support side of the triangle, we can strengthen the pelvic floor muscle. Okay, so how can we improve the quality of the tissue? We can improve the quality of the tissue by improving four main elements at the treated area. First, the collagen and elastin. Second one, the nerve sensitivity, and also the circulation, and lastly, the epithelium, the thickness. Okay, so, how can we improve the quality of the tissue? We can do that by using the non-invasive or mini-invasive technique, either alone or addition to surgery. Okay, and we know that the energy-based devices, which is non-invasive technology, are excellent devices to improve the quality of vaginal tissue. This is some of the excellent non-invasive devices that we use. And this is also the mini invasive, the aquitide. This is very good to improve the quality of the tissue. And we know that the idea of the energy-based devices is to stimulate the basal layer of the vaginal mucosa to form more collagen, more elastin fiber, and providing more intravaginal tone and more support to the bladder. Okay, so if we do that, we will notice the difference. This is the slide we saw before, but here, if we do energy-based devices, there will be a reduction in the vaginal canal diameter. Also, improve the pelvic floor support to improve the stress incontinence. So we will improve both the quantity and the quality. But also, this is true mainly in the first degree cases. So the energy-based devices will increase and tighten the introitus, also of the anal canal, and improve the stress incontinence, especially if the cases were in the first degree, mild cases. Also, it is also related. We can use it for relieving the local symptoms of menopausal, and we always say it's an alternative to combination to in combination for HRT. Okay, so also we can treat the vulvovaginal dryness and improve vaginal lubrication. In radio frequency, we can enhance sexual response and help female sexual orgasm, also increase blood flow to clitoris and improve the sensitivity and improve the orgasm. So, how can now the other question, the third side of the triangle, how can we improve the pelvic support? We can improve the pelvic support by improving the pelvic muscle, pelvic floor muscle. And our goal of the therapy is the rehabilitation of the pelvic floor muscle to reduce urine incontinence, pelvic organ prolapse, and enhance the sexual function. And we know one of the good devices and excellent devices for that is MCLA chair. It's high intensity focus electromagnetic technology. It will cause pelvic floor muscle stimulation. And as we know that strong pelvic floor muscles are the key to incontinence, and the MCLA chair is FDA approved for urine incontinence, and this is very important. And as a general, we know that all we agree that general strong pelvic muscle help in maintaining urinary and fecal continence, as well as enhancements of sexual pleasure. So we have to work on that. Now, As we said before, we have four most common problem. The vaginal laxity. So in vaginal laxity, we can rejuvenate or tighten the vagina by using energy-based devices and MCELA or electromagnetic stimulant chair. Also, in addition to surgery if we need it. So we have to complete the three triangle side. For the common problem too, the stress urine incontinence, we can treat mild, moderate degree of urine stress incontinence, at least improve the condition by energy-based devices. We can use it, or also BRB or nano-fat injection and insular chair, the electromagnetic chair. And we have to remember that the time the initiation of treatment before a mild and moderate incontinence progress to severe problem is extremely important. The success of timely treatment with non-invasive method is more efficient and sustainable. Consequently, the surgical treatment can be avoided, or at least we can postpone it for several years. And so, this is very important to use the non-surgical technology for urine incontinence, such as radiofrequency or HIFU or laser. Coming to the third problem, which is decrease or loss of sensation during sex, we can use the radiofrequency to tighten the vagina or to improve the quality of the vaginal wall and erectile tissue. In addition to injectables such as BRB or nanofat, and use also the chair, insular chair, the electromagnetic chair, okay, for pelvic support. The last problem, the common problem, which is the pain during sex or the discomfort, we can also use energy-based devices or any injectables such as BRB, BRF, fillers, nanofat, anything. Also, we can use AMS, which is the energy, the chair, the electromagnetic chair. If we just want to focus on aesthetic procedure, we can also use the non-invasive or mini-invasive technology in addition to the invasive one. Not only the invasive. Try not to use only invasive. For me, I like to use first the non-invasive and pelvic support. Then at the end we will do the surgery, because sometimes if we finish, for example, if we just work on those two sides of the triangle, the invasive, the mini invasive, no, sorry, the quality and the pelvic floor, the condition will improve, so it will not need surgery, or maybe she need, but not too much. So we have to think always what and where is our goal. But we have to remember that anything we have to think about it, we have to consider the safety and the effectiveness of that approach. So we have also to identify the aim to which level we have to go and reach. So we need, we have to choose which approach and technology level of the energy in combination therapy to have a good result. So to do all that, we have not to forget this triangle. I really believe in that triangle, that and I call it the effectiveness triangle, which is have three sides. This is just to summarize: the quality, the quantity, and the pelvic support. For quantity, we can do it by surgery, which is invasive, and we can improve the quality. Also, we can reduce the size if we have, for example, the caliber of the vagina. For example, if it is in the first degree, we can use the non-invasive energy-based devices, or we can use, for example, for the labiaplasty, we can use the mini invasive, which is acutine. And for the quality issue, we can also improve it by the non-invasive or the mini-invasive procedures. And lastly, the pelvic support, we can use it by Kegel exercise, of course, and by the muscle strengthening by the electromagnetic chair. And thank you. I hope you enjoyed, and you will follow it.
Yeah, very nice, Dr. Salva. Very nice lecture. You have beautifully
Thank you.
covered all the things. So, meanwhile, once we are, yeah, sorry, yeah. So, meanwhile, once we are getting some questions from the audience, So, as my this show name is the Icons in Conversation with Dr. Ritu. So now I am going to ask you some non-academic questions. Dr. Salwa, with your permission,
Yes.
some non-academic questions, and it is kind of a rapid fire round. You have to answer in one word without thinking much. So,
Yes, okay. What
so
discussion?
yeah. So the questions are like that. Which is your favorite
Ritu.
fruit? Which is your favorite fruit?
What?
Which is your favorite fruit?
My
Favorite
favorite what? Root?
fruit?
Root?
Yeah. These are
Um,
non-academic questions.
why these questions?
This is non-academic
Uh,
questions.
I'm no favorite. I like everything.
You like everything.
Yes.
Oh.
I try to like everything and I manage everything.
So nice. Then what your favorite color?
Black. It
Okay.
depends on for money for dress I like it black. For my bags I like black. But for drawing, for room, no, I don't like the black. It's different where what is the color and where I we use it.
Okay. 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 Uh,
I like the pink, but not the pink, the dark pink. This one which is the off pink, like the onion. I don't know what they call it
no, we got
with
it. We got
beige.
it. Yeah. Yeah. And you are a tea lover or coffee lover?
What?
Tea or
Tea or
coffee?
coffee? Coffee,
Coffee.
coffee.
Okay. Okay. And what motivated you to become a doctor? Is it your childhood
My
aim to
mother.
become a
My
okay?
mother. My mother. She want to be a doctor, but she cannot be a doctor because at that time we don't have college for medicine for ladies. So I am her dream.
Okay, great. So, any of the interesting places where you have visited, you want to take the name, which you visit so many places to teach the doctors. So, which is your favorite place?
No, but no, really, I like Egypt. You know why?
Why?
I like Egypt because the people here, not the country, the people. The people here, they are laughing, and I love laughing. I love their soul, like this. But other country is more beautiful. I like Turkish. Turkey are very nice. India nice also, but not all, not area. I like also, uh, which is Vienna. It was very nice. France, but not all. Just evil part and Champs-Élysées, all this. But most, the most country I like it, Egypt. The
Okay.
people, not the country. The
Okay.
people.
Okay. 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 So, are the friends who have joined from the Egypt for this show really very, very happy to listen these words?
Thank you very much.
Uh, Doctor, in our language, once we greet each others, we say like this, Namaste. So, in
Namaste.
Namaste, yeah. So, will you want to share any one word of your language you want to teach us of your language? Any one word?
In our language. Uh,
As we greet Namaste, you greet I think as Salam, and any one word if you want to teach our audience is up to you. It's just a question
yes,
from
yes,
you.
but yes, but when you ask any question, all answers disappear.
Yes, true.
all my list because I have a lot, but I forget. أهلين لا أهلين نورتوا نورتوا means when you come we have a pleasure to become here and we have a lot of flights in this area so نورتوا from light.
Okay,
uh,
okay. Thank you so much.
okay,
And
welcome.
I don't think we have received any questions. So before we wind off, the only last question: your message to another any message for the upcoming cosmetic cosmetic gynecologist, because all the doctors see you as a role model. You created a history. You are one of the icons in the field of the cosmetic gynecology.
Thank you very much, Wallahi. No, we know the most important thing, you have to love whatever you want to do. Love your work. This is number one. Think about the patient as you are the one who in front of the patient. Don't do over expectation for the patient, even if you are sure of the result. Because if you do over expectation, she will not like, or she will not be happy about anything you will do, because our expectation is very high. So just reduce it so she will be happy with whatever you will do. And try not uh, to reduce, for example, some of the people now, they reduce the self-esteem of the patient, of the women, just because they want them to do surgery or they want to do them procedure. No, don't do that. Think that you are the one here. Do for the patient whatever you want to do for yourself, and try to work as much as you can do. Start with volunteer, don't start with the patient themselves. And inshallah you will be greatest doctor in the world.
Thank you, thank you, thank you once again, Dr. Salwa, for your
Thank
precious
you.
time and your lovely
Thank
lecture.
you.
I always enjoy hearing you. Every time once I
Thank
hear
you
you,
very much.
I always gain some of the other thing. Thank you once
Thank you
again.
very much. Thank you very much. Thank you. Bye.
Yeah. So friends, we are winding for the today's session. So next Thursday at 8 p.m. Indian Standard Time, please do tune for the interesting episode, The Icons and Conversation with Dr. Ritu. Next Thursday, we are having Dr. Muhammad Tayyub, all the way from the Bangladesh. He is going to discuss with us a very important topic, the cord complications after the laparoscopy procedure. So till then,
Inshallah.
bye-bye,
Thank
friends.
you.
Yeah. Bye. Bye.
Bye.
Bye.
Bye.